All right. Well, thank you, Amber. And yes, I'm Dr. Clark, and I'm the medical director here at the Center for Hormone Health and Wellness. I also do weight loss, so you may know, some people may know me from that as well. But we're going to cover some, what I'll call some controversial things, because hormone optimization, hormone replacement is a controversial subject. And what I'd like to do is kind of get around a lot of misinformation that's out there. There is a lot of misinformation, and unfortunately there's a lot of misinformation not only for the public but also for many physicians. And so I'd like to talk about, we're really going to go towards bioidentical hormone replacement, which is much different than synthetic hormone replacement. So we're going to go in, we'll talk about kind of, what is the controversy, talk a little bit about kind of different ways of delivering hormones. We'll talk about some of the medical things that they can improve, but the bottom line is what we're trying to do is improve health and just get people to feel better. We often think of many things as being normal, and you'll often go to your physician and they'll get a lab checked and let's say, well, you're normal. But with many things, what we find is that if we can get you at the right end of normal, because normal typically is a bell-shaped curve, and they're kind of, you'd like to be on the right end of normal, not the wrong end of normal. And we're on the right end of normal, we just feel better. All right, so a little bit about myself before we dive into there. I do specialize in weight loss. I've done weight loss surgery for the last 22 years, medical weight loss for the last 12 years. I am the founder and medical director of the Center for Weight Loss Success in Newport News. But I'm also very interested and have a long-standing interest in hormone replacement. Some of that is because our patients ask for this all the time, because many people are convinced that, my hormones aren't right. But I've seen my doctor and he says I'm normal. And so, okay, that's where kind of the clash comes in, is that you're actually probably right. Your hormones may not be where they should be, but unfortunately that still means they may fall into a normal range, but it just may be the wrong end of normal. So I am a certified practitioner of the BioT method, which is a large corporation. The people doing it has been around for 30 years, have 50,000 patients behind it, of how we replace hormones, because there are different ways to replace them. I'm also here, the medical director at the Center for Hormone Health and Wellness here in Newport News as well. So we're talking about here, and where we're going with this is subcutaneous hormone pellets. So I throw this out here. This is just a little picture there of someone's hand. And just give you an idea of what we're talking about. These are little pellets that are hormones, and they're truly bioidentical hormones, not synthetic hormones, which means when we say bioidentical, it looks exactly like human hormones, not synthetic hormones that may have come from horse urine or whatever. So this is really kind of the best way, and then it's not only using bioidentical hormones, but also potentially how they're delivered, because there's also multiple ways to deliver hormones, because you take medications as pills, or you can use creams, you probably hear of injections, and you may see all this stuff kind of advertised, and you may see TV commercials, etc. on it. What we find is actually for getting correct, good levels, and getting nice, smooth levels where we can keep them where we want to, is that pellets tend to work very well for certain hormones then. Balance is key. I throw this up here because it reminds me to talk about just balance in general, balance in life, but really balance in hormones. When we start manipulating one hormone, it's not like all the other ones, nothing happens. Because we start manipulating one hormone, your body is very good at adjusting, and it'll actually can take up the slack different areas. So balance is key. You'll hear me say this all the time. If you're familiar at all with some of my webinars with weight loss, I bring this topic up all the time. Balance is key. When we're out of balance, we feel poorly, and this is especially true with hormones. Now, what is a hormone? We throw this word out all the time, and people just they have this idea of what is a hormone. But a hormone basically is just a chemical messenger. That's all it is. There are certain organs or tissues in our body that actually make different hormones from, the thyroid makes thyroid hormone, the testes make testosterone, the ovaries also make testosterone, they make estrogen and progesterone too. So there are lots of different hormones out there, but hormones are just chemical messengers. They're chemical messengers that communicate between one part of your body to another part of the body. And only the tissues that have the receptors to the hormone will respond to the hormone then. So the hormones are sent out through the bloodstream and into your whole body, but only the tissues that have receptors on it. It's kind of a lock and key phenomenon. If you have a lock in the door, you have to have the right key to make it open. And that's kind of the same type of concept with hormones there. So hormones are one of the main tools that your body uses to maintain what we refer to as homeostasis, which basically means keeping your body in balance. And that's really kind of balance in all ways. So again, hormone balance is key. I talk about this all the time. One gets way out of whack, it does affect the other ones. Now, the biggest things that we talk about often are sex hormones. And one of the reasons that's so important is because these are the hormones that truly are your feel-good hormones. They're all derived from cholesterol. Then the sex hormones include really three major ones: testosterone, progesterone, and estrogen. Okay? Estrogen, there's actually three different types. Estrone is E1, estradiol E2, estriol E3. Okay, so that kind of makes sense. So estradiol, though, is the main one. Okay, that is the one that really is affecting women the most. Estrone, more important, kind of actually it's one you want to keep relatively low because estrone typically makes you gain weight. It also goes up after menopause, which, yes, that's why women sometimes gain weight after menopause. Their estrone levels go up. Estriol, kind of more important during pregnancy. It's not something we're so concerned with at this point in this discussion. Now, men and women all make these hormones. The only difference is the absolute and relative amounts of them. So, yes, men have some estrogen, men have some progesterone. They're just very small amounts. Women have testosterone. It's actually an incredibly important hormone for women, too. And so women make about 10% of what men make. So it's very important for all humans, okay? So I throw this picture up there, hormone havoc, and this is often the way people feel. They just don't know what they do. They just don't feel right. Now, throw out a little background here. Every day, about 3,500 women enter menopause. Symptoms, though, of menopause can begin up to 15 years earlier. The average age of menopause is somewhere between 50 and 51. So its symptoms can occur up to 15 years earlier. So we're talking mid-30s now. Now, that it's basically meaning they're not making as much testosterone. And it's present in almost 40% of males over 45 years old. So this obviously is a very common thing for males too. This isn't just a female thing. Men lose up to 3% of their testosterone production per year after age 35. For women, progesterone decreases significantly after about age 28. And if you've had children early in life, and the more children you've had in life, these hormone levels tend to drop off even faster. All right, let's talk about some of these main hormones. What are they and what they do before we get into kind of what do we want to do about it. Okay. Estrogen, it's the primary female hormone. Both your adrenal glands and ovaries can produce estrogen. And actually fatty tissue can make a little estrogen too. So estrogen has 400 different functions on many different tissues. Now, that's an important point because we think of just, estrogen, gee, it's important in your uterus and it's important maybe for breast tissue and important for kind of keeping your cycles right. But actually it's 400 different functions on many tissues. And our brain, breast tissue, bones, blood vessels, reproductive organs, those are some of the more important ones there. But it's very important. So when estrogen goes away, menopause, okay, when estrogen goes away, it can affect lots of different tissues there. So it's no surprise there. Adult women, again, produce those three estrogens. Estradiol is the main one. Progesterone is the natural antagonist or kind of a balancer to estrogen. You need to think of it kind of as the yin and the yang of the female hormone system. You don't want too much of one without the other, so it's a relative balance. That's what keeps your cycles regular, okay? That's also maybe why it's irregular. And then eventually when you get a lot of these symptoms, because progesterone levels fall very quickly or very early early, sometimes in late 20s. So it's this relative balance that determines either a state of just physical and emotional well-being or having all the unpleasant symptoms. So progesterone, again, produced by the ovaries, like estrogen is, but there's also small amounts produced by the brain and the adrenal glands. And again, receptors are found all over the body. So it's not just the reproductive organs that are important. The brain, the breast, blood vessels, bones, all the reproductive organs as well. So low progesterone levels, if you've got very low progesterone levels, women have a higher risk for fibroids, also endometriosis, and potentially uterine cancer. Testosterone, we think of this as the male hormone, but it's not just a male hormone. It is made by both the adrenal glands and the ovaries in women. For men, it's the testes and the adrenal glands. So testosterone is critical, absolutely critical to optimal function of many systems. We also think of it as sex drive, but extremely important in heart health. Preservation of bone and muscle mass, this is how we keep it. Your overall just sense of well-being. Truly, your testosterone is the vitality hormone. Women produce about 10% of testosterone that men do. Production levels fall by 50% age 20 to 40. So this is early in life and continues to fall until after menopause. And often after menopause, for some women, it's almost non-measurable, but it's still important. It drops even more during pregnancy, which is kind of an interesting phenomenon, because when it drops during pregnancy, and then each successive pregnancy tends to lead to a 10 to 15% further drop. Now, that's an interesting fact, because this is kind of what drives your overall feel-good, but also your sex drive. And it's kind of nature's family planning, in that often the more pregnancies you've had, the lower your sex drive becomes. And so that's because we do need to remember, and it's not something you need to remember, but it says physicians, that testosterone can actually be converted to estrogen in fat cells. And so even if you made no estrogen, the fact if you have some testosterone, that's kind of why men also make estrogen. And it's because some of the testosterone is converted to estrogen. Now, when they start getting out of whack, these are very common symptoms. We think of the hot flashes, night sweats, but there's also kind of I'm just tired, mood swings, tension, lack of sleep, very poor sleep. So if you have poor quality sleep, this may be the reason. Memory loss, decreased sex drive, depression, very common there, but other things, the weight gain, joint pain, migraines, severe headaches, just that overall fatigue, get into the afternoon and you just hit the wall, I don't have anything, I've got to have caffeine all afternoon to keep me going. For men, loss of erectile ability. It may not be a Viagra deficiency, it may be a testosterone deficiency. So, some of these things sounding familiar, I imagine. Now, I do want to go back to that bioidentical versus synthetic hormones, because this is where some of the controversy lays. And when we talk about controversy with hormones, about in 2003, there came out a great big study, Women's Health, which we're going to go into a little bit more, but basically it showed, gee, there's some increased risk with some of the hormones. But the issue there is, and the media jumped all over that, and physicians jumped all over that, because it was the big study that was done on synthetic hormones. And synthetic hormones don't look exactly like human hormones. Now, part of that is because drug companies can't patent something that occurs in nature. So something that occurs naturally in nature, such as your hormones, they can't put a patent on it and then make it into a drug. What they have to do is take that and change it a little bit. And so if it's changed a little bit, now they can patent it. And they can sell it as a different drug, even though it's trying to do some of the same things. But the issue there, it's the kind of part of it, the part that doesn't look quite like human hormones, that causes all the problems. So just the diagram in here, I have just the progesterone and basically the synthetic progesterone at the bottom. And you'll notice there's a couple little extra things on that bottom figure, and that's where the problem areas were. So when people started frowning on the Provera, because Provera is not actually progesterone. It is progestin, which looks a little different, and that's where the problems came in. So again, in this Women's Health Initiative trial, there's literally hundreds of thousands of women in this trial over many, many years using synthetic hormones. Prempro was one of the big ones. But we saw an increase, a 41% increase in stroke, 29% increase in heart attacks, 26% increase in breast cancer, twice the rate of blood clots, 76% increase in Alzheimer's. And basically everyone said, oh, hormones are bad, we got to get rid of them. And the bottom line is, well, hormones themselves aren't bad, but synthetic hormones potentially do cause all these problems. When they actually looked at the ones that used bioidentical hormones, they did not cause those problems. Now, bioidentical hormones don't tend to cause those problems. Actually, they can protect you some, which we'll talk a little bit more about in a minute. But there are some, if you're taking hormone supplements, that can be given as pills. So oral estrogen. What is it? Tends to cause a lot of things it doesn't necessarily need to. Breast tenderness, increased risk of endometrial cancer, vaginal bleeding, headaches, nausea, vomiting, fluid retention, blood clots, leg cramps, gallstones. Now all this is because it's given orally. When we take something orally, you have first place it goes is to your liver. And your liver actually can break estrogen down very efficiently, and it's the breakdown products that actually cause some of the problems there. So given in a different fashion, we don't see those problems. And that's why sometimes using patches or creams, that's another common way of giving them, we don't see a lot of these other problems. So patches, it's another way of giving it, and we can give bioidentical hormones as patches. And so we do see a little bit better estradiol levels because, again, it doesn't have to get digested and broken down in the liver. It's absorbed through the skin, but we don't see them at where they really should be, where we get rid of all the symptoms we'd like to. Now, in order for something to work well to be absorbed through your skin, there has to be an irritant in it because the skin is normally just a barrier, and it tries to keep things out. So in order to be absorbed well, there has to be some type of an irritant in it, and therefore you have to keep changing where you put the patch. Where you put it on will affect how well it's absorbed, and so there are lots of different problems. Some women would see weight gain, a little less fluid retention, but it's much, at least a step in the right direction when you compare it to the synthetic or horse estrogen. And I didn't really mention it. Progesterone, Premarin, came from pregnant mare's urine. That's where it came from, and it's horse estrogen. Horse estrogen does not look like human estrogen. So we shouldn't be surprised that there are some problems with that. Creams and gels, so it's another way to do it. Instead of a patch, you could rub on a cream. But there's lots of different issues there too. Did you apply enough? You have to remember to rub it in. There's a short half-life. Again, it's hard to get the levels that we want. And now you can also transfer it to other people, things, babies, pets, and that can also cause problems for them. And a lot of these creams, especially as trial, doesn't really give you the bone, heart, and brain protection. It could be given as injectables, okay? Testosterone is commonly given as an injectable. Uneven absorption, so you really get this roller coaster effect then, up and down, up and down. It is an injectable hormone, typically is a synthetic hormone though too. So then now we're back at the synthetic problems though. So there can be synthetic problems from liver toxicity, coronary artery disease, prostate cancer, and others for men that are doing injectables. Now, testosterone itself, we think of it is different than anabolic steroids. You often think of bodybuilders or athletes taking anabolic steroids. Anabolic steroids are different than testosterone. Now, testosterone can help you bodybuild, but anabolic steroids don't get broken down like testosterone, and that's where the problem is. They're broken down very differently, and therefore they become very dangerous. Injectable testosterone can increase your LDL. It can decrease your HDL, which is the good cholesterol. You don't want that to happen. And typically it wears off very quickly. And so you get this roller coaster effect, and every time it's wearing off, it makes guys really cranky. So which kind of, okay, can we give these bioidentical hormones in a better fashion? So pellets was something else then. So pellets have actually been around a long period of time, and we can do bioidentical hormones. It truly looks like your hormone. That's all it is. It's your hormone. So it's either testosterone, estrogen, and it looks exactly like human hormone then. So So bioidentical, both estrogen, testosterone. Now that doesn't mean it actually came from humans, because chemists, okay, can basically take some of the products from the yams and actually make it into the estrogen, testosterone. Now that doesn't mean if you ate a lot of yams. Sometimes people come and say, Dr. Clark, you said they come from yams. I ate a lot of yams, I could fix this. As through chemistry, they have to actually take it and can make it look like bioidentical human hormones, and they can do that. Better living through chemistry there. So it's constantly, when you have it in a pellet form, it's constantly available. You don't get these big up and downs. It's absorbed directly. It's absorbed specifically by blood flow. So we place these little pellets underneath the skin in the subcutaneous tissue. Typically we do it in your butt cheek. Okay. You don't get this roller coaster effect, though. Tends to be very minimal weight gain, if any. It is very safe, hassle-free. Basically for women, it's about every 3 to 4 months. For men, it's about every 4 to 6 months. And we can individualize the dosing then. So we can kind of measure your levels and figure out what's going to be kind of the right doses for you, and it lasts much longer than other treatments, so we get nice smooth levels. This is just a little picture of what a pellet looks like. So they're about the size of a grain of rice for women. For men, it's a little bit, this is probably a man's pellet there actually, because it's a little bigger. But for women, it's about the size of a grain of rice. It's been around for a long period of time. People often think this is new. It's not new. It's been around since 1930s and widely used in Europe and Australia, just not so much in the U.S. Now, lots of studies have been done on pellets, and we find that there is no, and this again using bioidentical hormones, there's no increase in thrombotic activity with pellet therapy. It actually reduces cardiovascular risk compared to oral therapy, and it does not increase the risk of breast cancer, which is kind of the big three that people are often worried about. And actually we see some protective effects from it, not an increased risk. Other things that we see with kind of other medical studies, osteoporosis, testosterone, and also estrogen is a bone builder. So you can take all the vitamin D and calcium you want in the world, but if you don't have the testosterone and estrogen to help you build bones, because testosterone itself is probably the best bone builder, and if you have osteoporosis, this is one of the best things that you could do for yourself to improve your bone health. Breast cancer study, obviously this is a big issue because breast cancer is extremely common, but testosterone now is actually being considered and utilized for some places. They're actually implanting testosterone pellets in women that have breast cancer because it actually helps prevent recurrences. That is some of the latest and some of the cutting edge type of thing. It's certainly not, you know, the common thing going on, but testosterone delivered by pellet does not increase the risk of breast cancer. That was something that was kind of sometimes thrown out there, and it shows less stimulation of breast tissue. And so these can actually potentially be used in breast cancer survivors. Now that's a very controversial subject, which I'm not going to go into too deeply here, but it really could be. Alzheimer's disease. Now women get Alzheimer's disease about 8 times more than men do. Now some of that is because they don't make as much testosterone. So women on testosterone are actually 50% less likely to develop Alzheimer's disease. And just from looking at studies on men with low testosterone, so they don't have much testosterone, are 3 times more likely to develop Alzheimer's disease. So some of these things we don't normally think about, that the receptors are there for these hormones, and it is important that they don't go to zero as we age. Arthritis, same type of thing. Arthritis, again, we can build bone with kind of especially with testosterone, but both estrogen and testosterone can stimulate some of the cartilage cells that are still in the tissue. Even if you have, you know, if you want to say, gee, my bones are completely destroyed, some of the cells, the chondrogenic just means cartilage cells, they're present there. And estrogen, testosterone can actually stimulate that. So we can actually see some improvement in arthritis with replacing both estrogen and testosterone. So these are things we don't necessarily think of. Now, how do we actually do this. Okay, it does take a little minor procedure. The pellets are basically placed in the subcutaneous tissue, basically the fatty tissue in the buttocks. So it's kind of on the butt cheek. It takes literally about a minute to do the procedure. We do it under a local anesthetic, so there's a little bit of bruising, a little bit of swelling, very minor soreness. You need to be a little careful for a few days after the pellets have been implanted. You don't want the muscle action if you're out lifting or doing squats or riding your bike for 20 miles. You wouldn't want to work that pellet out. So we generally tell people to avoid strenuous exercise for the first 4 to 6 days. And again, as far as how long they last about 3 to 4 months in women and about 4 to 6 months in men. For men, it lasts longer because we have to use bigger doses, and there's slightly bigger pellets then as well. So for women, it lasts about 3 to 4 months. We typically we check your blood work ahead of time, so we can figure out correct dosing, and then about 6 weeks, 4 to 6 weeks after you've had the pellet placed, we're going to repeat some of the blood work and make sure, hey, we've got our dosing right. And so subsequently then we can check up on that. So what do we see then with all this? I mean, we really see kind of, if you want to call it that, I just feel better. But when you actually ask people, they increase energy levels, improve sleep, restored interest in life, increased sexual drive, just consistency in moods, so you don't see that up and down moods, relief from just anxiety and depression, increased mental clarity, decreased body fat, lean body mass. Testosterone helps you preserve that lean body mass, muscle mass, and just that greater capacity for getting the body, what I'll call it, in shape. And so you get a lot of different benefits from this besides all those potential health benefits we see, because we see cholesterol improve. You actually get some protection from heart problems, protections from some of the breast problems. So there are other things that we often don't consider, and these are kind of how do you feel, and those can be some of the major ones there. Now, cost obviously is an issue there for many people, and we understand that. So, typically if someone's seeing me, we can see some of this actually through insurance. You can get your labs done, it's covered by insurance. Now, having said some of these things are covered by insurance, certainly co-pays and deductibles, and that's, evolving over the healthcare changes that are going on in the U.S. But the lab's often covered by insurance. Same thing with the consult. We can see you through insurance, so it's often covered by insurance. We actually do that through the Center for Weight Loss Success, but then the actual procedure is a non-covered procedure, and so it's not a recognized, meaning that there's no code. Okay, and that's what typically insurance companies don't recognize any code for this, so they don't recognize the procedure as a legitimate procedure. So there is basically the procedure itself is not covered by insurance. The prices we have listed on there, but for females, it's for each procedure, it's $425. For males, because it's a little bigger procedure with bigger doses and takes a little bit, I'd say a little bit more time. It takes about 5 minutes as opposed to 2 minutes, and it's either $725 or $825, and that's dependent on if you needed either the low dose or the high dose, and it's just we figure that out as we look at your labs and a lot of different health issues there. All right, so and if this is something you're interested in, okay, we encourage you to do is contact us, number one, but just get your labs drawn. If you get your labs drawn, we can schedule a consultation. If you do that by December 1st, we'll actually get you on coming out with a book, Are Your Hormones Out of Whack? We'll get you a digital copy of that new book. We're not sure exactly when it's going to be ready, but we will get you on the list. You just have to call us. The phone number here is at 757-223-0940. And we also do have some other specials sometimes ongoing. And you will receive bonuses, including some gift cards, B-complex injections. I do like to make sure that people do understand a lot of places that you may go for hormone replacement may require you to sign a contract that you're going to do this for a year. There's no contract here. Basically, I want you to feel better. So we're going to sit down and go over all your lab results one-on-one, decide if this is something you want to try, and we'll do it. And if you want to do it and proceed, we'll do it. And if it works, great. We can keep doing it. That's the point. I think it's silly to have someone sign a contract that they have to do it for an extended period of time. The point is to really try to get you feeling better and improving your health. All right, so kind of I'll throw that out to questions there. Again, I have the contact information on the, for the Center for Hormone Health and Wellness there on the screen. We're in J. Clyde Morris, 645 J. Clyde Morris, Newport News, Virginia. The phone number's there. Also our website, which is Center for Hormone Health and Wellness.com. I've got this kind of an extended webinar on here. I covered some of the basics here, but I go into a little more in detail on that webinar. You can watch that as well, or you can just come in and see me. So, Amber, I'm going to throw it back to you. Do we have questions coming in?
We do, and Dr. Clark, I have to tell you, that was really, really interesting. Just personally, I wasn't aware of a lot of what went into all of this, and so thank you for that information. We've had a number of different questions come in, so I don't think we're going to be able to get to all of them. However, if anybody on the call would like to submit questions, please do so, and we'll make sure to follow up with you individually. So I'd like to get to a few of these really quickly. The first one is, will bioidentical hormone therapy, someone was paying attention, help me lose weight too? So does this help with weight loss?
Right. I guess it's a complex answer. The short answer is yes. Okay. The long answer is, well, all these hormones, it depends on the hormones, it depends on your levels, it depends on what you're trying to accomplish, because both testosterone helps preserve lean body mass, which helps preserve your metabolism, keeps your metabolism higher, which helps with weight loss then. Estradiol, because some estrogen actually makes you gain weight, estrone, but estradiol tends to be weight neutral. Progesterone itself kind of potentially people can gain, so we try to use as little progesterone as possible, but if you need it for symptoms. But the short answer is yes, it can help you with weight loss. And I didn't really go into this much, but I do want to just mention this. We don't only look at these sex hormones here. We mentioned, you know, the pellets are kind of estrogen and testosterone, so that's why we concentrate on that. But we do look very closely at thyroid too, because many of our patients not only have low testosterone, low estrogens, but they actually have not, or what I'll call suboptimal or sometimes low thyroid function too. And so we look at that very closely, and that certainly with hormone replacement there and absolutely help with weight loss.
All right. The next question is, and this is actually a great question, how do I get started? So if I wanted to go ahead and take my first step, what would
the easiest way to get started really is just kind of get set up, get your labs drawn, because it's hard. We don't know where we're starting, so to speak, until we know your individual labs and kind of. So what we have you do is just give the office a call. We will get you set up. We have draws here at the office, and we will get you set up to do that, to get the labs drawn, and then we'll set up a time, you know, literally if it could be almost within a few days, because we just need a few days to get the labs back, and then I will sit down with you and we'll go over all the results and what does this mean, and we have ways to kind of figure out what's the right dosing, and we'll talk about, again, not just the testosterone, estrogen, but also the thyroid and the other hormones that we talk about as well. So that's the easiest way. Give us a call. We'll get your lab set up and get going.
And this one actually feeds into that. How soon can someone come in to get their labs done and meet with you?
Right. Well, very quickly. I guess. So I mean, really, give us the call. We have there are certain days that the lab draws are here at the office, but we can get that set up pretty quick. So I mean, literally, if you were interested, we could get that set up for this coming Monday. As soon as that, and literally I could see you later in the week. So wow. I mean, it doesn't take that long at all. We try to accommodate for people's schedules. We try to accommodate, and this is true with our weight loss too. Is we try to accommodate with that and get people in when they're when they're most concerned. And typically, once they want to get started, they want to get going. Yeah.
Right. Right. So I think this will be our last question, but I think this is my new favorite question. Are there any tricks to getting my husband to come in as well?
Yeah, right. Good one. Now, just from looking at, just I throw out some percentages here. This is true with our weight loss as well as our hormone replacement too. Probably, about 75% of the patients we see are women, okay, 25% men, but men need this. Okay, so how do you get them to come in? Because men are they don't want to go to doctors, and they don't want to, don't want to admit that, gee, I might be a little low in something that's a manly hormone that I could use. Well, one of the things I'd say is, why don't you come in and we'll get all yours tested, because if you get involved in this, not you particularly Amber, but I say you, anybody out there, if the woman gets involved with this, they're going to see, their husband is going to see how much better they feel, how much better, and they're going to want to come in too. So that's probably one of the best ways, to just lead by example, so to speak. The other tricks there, I don't know, but you can literally from, the heart protection, improve cholesterol, you can start using some of these other things if they have other problems that you can start looking at. It's going to help you with that, sleep, whether your moods, how well you feel. Truly, for males, it's, we're talking about testosterone. We're not giving males estrogen, but we give testosterone, and so subsequently then it's truly your feel-good hormone, and it's truly your overall vitality for life.
Please feel free to call us, visit our website, and contact us and let us know how we can help you in the future. And Dr. Clark, thank you so much for all of this really valuable information.
You're welcome. We'll be seeing you here shortly at the office. Take care.
Thank you.